So we're getting ready for our bunion procedure, and typically we do it under local anesthesia, but I do give a little bit of a sedative to have patients be calm and comfortable with the procedure, because some patients are a little anxious and they don't want to hear anything happening. They don't want to hear the burr of our machines and things like that. Some patients want to be completely awake. They feel better when they know exactly what's going on. Now, no one is seeing anything, not the patient, not, no, they can't see what's happening. However, they hear, you can hear us talking, you can listen to your own music, you can, if you just want to chill music, relaxing music, hype music, whatever it is that, fits your fancy. And because it's, again, minimally invasive, there's not a lot of machinery or a lot of things that you're going to be hearing that's going to be quite distracting. So we're excited to start on our patient today, and he's going to do great. 10 cc's of Morphine. Careful with walking around this thing. You got to be careful. All right, so finished the procedure right now. So I don't use any screws. The toe is straight. It looks absolutely beautiful. Patient doesn't have to worry about using toe separators or straighteners or anything like that. I'm gonna be very, very happy with it.
Shake it off of me. Somebody's watching